50% of the population is deficient in vitamin C, and this is particularly concerning for the cancer population where they have increased inflammation, increased oxidative stress, which is increasing their utilization of ascorbate. And cancer patients are presenting with literal signs of scurvy because they have such low vitamin C levels. So in this video, we're going to talk about vitamin C, its history in medicine, and its potential role as an aid in cancer treatment. So I have to put this disclaimer in the video. The contents of this video are not intended to substitute for professional medical advice, diagnosis, or treatment. So in this video, we're going to just go through all the different studies. This is all based on literature that I've seen. You can see all of the sources below. And like I said, guys, I'm not giving you any medical advice, okay? So what is vitamin C? Vitamin C, it's a water-soluble vitamin. Your body does not make vitamin C, which means you have to get it through the things that you consume, like fruits and vegetables. You have to get it from somewhere. It's a super potent antioxidant, so it helps reduce inflammation. It helps reduce oxidative stress. It also helps with collagen synthesis. So your skin, your tendons, your ligaments, your blood vessels, they all need vitamin C to maintain strong integrity. It also helps with your immune function and also with iron absorption. So vitamin C as a treatment, it's not new. This is something that goes way back to even the 1600s. So in the 16th century, scurvy was a big problem. Scurvy, if you don't know it, sailors, they were presenting with weakness, lethargy, bleeding, and eventually they would die. And it was so bad that more sailors were dying of scurvy than any other naval-related incidents ever during the periods from the 16th to the 18th century. And this was due to a lack of access to fresh fruits and vegetables, which we know now are high in vitamin C, but back then they didn't really know. And it wasn't until 1747 when Dr. James Lind discovered that eating fresh oranges and lemons prevented scurvy. But they didn't know why it did. And it wasn't actually until almost 200 years later, in 1937, when biochemist Albert Szent-Györgyi isolated the anti-scurvy substance, calling it ascorbic acid. And he was actually awarded the Nobel Prize in Physiology and Medicine for this. So today, vitamin C, it's a popular health supplement due to the increased access to fruits and vegetables. And even though it's more readily available than ever, a lot of people are still super deficient in it. And in fact, 7% of the US population has levels so low that it's considered scurvy. So vitamin C, it was traditionally used as a treatment for scurvy, but now doctors are hypothesizing that due to its anti-tumor effects that it can aid in the treatment of cancer. So this goes all the way back to the 1970s. Dr. William McCormick, he observed that his cancer patients were presenting with severely low levels of serum vitamin C, and they were featuring scurvy-like symptoms. So this led him to hypothesize that vitamin C might protect against cancer by increasing collagen synthesis. And in 1972, expanding on this theory, Dr. Ewan Cameron, a Scottish surgeon, hypothesized that ascorbate could suppress cancer development by inhibiting hyaluronidase. So he began treating cancer patients with high doses of vitamin C and published a case report of 50 of his patients in which some of them benefited from the high dose vitamin C. So going off of his initial research, he ended up teaming up with Linus Pauling to conduct a clinical trial involving 100 terminally ill cancer patients who they treated with high doses of intravenous vitamin C, which is important to remember, and compared it to a control group of 1,000 other patients who were not treated with the high doses of vitamin C. And here's what they said for the results, because it's quite interesting. The results demonstrated that patients treated with vitamin C had improved quality of life and a 4-fold increase in their mean survival time. So when you see a result like that, you're immediately thinking that, wow, this is really awesome. And then continuing on, in a follow-up study, Cameron and Pauling reported that 22% of vitamin C treated cancer patients survived for more than 1 year compared to only 0.4% of control patients. And there's also a clinical trial in Japan that independently showed a similar result. All right, so let's take a look at the study that they published. Supplemental ascorbate in the supportive treatment of cancer, reevaluation of a prolongation of survival times in terminal human cancer, published 1978. So what they did is they had 100 terminally ill cancer patients and they treated them with 10 grams of ascorbate daily. And they did this orally and intravenously. And what they did is they compared the outcomes of these 100 patients versus a control group that also had terminal cancer, but were not treated with the high doses of vitamin C. And here's what they concluded. Quote, we conclude again that there is strong evidence that treatment of patients in Scotland with terminal untreatable cancer with about 10 grams of ascorbate per day increases their survival significantly by average of about 300 plus days. Larger amounts might have greater effect. And they continue here. There is little doubt, in our opinion, that treatment with ascorbate in amounts of 10 grams per day or more is of real value in extending the life of patients with advanced cancer. So when they're having such great results like this, why are we not pursuing the understanding of high dose vitamin C in the treatment of cancer further? Like, why is this something we're still not pushing studies out? Why is it something we're not offering to patients in oncology units? Well, because there was a Mayo Clinic study actually done where they couldn't reproduce the same effect. They treated patients with vitamin C and they didn't get the same effect. So why didn't the Mayo Clinic get the same effect? Well, it was because they didn't use intravenous high dose vitamin C. In fact, they just used oral high dose vitamin C, which is completely different because the bioavailability of vitamin C is different when you take it orally versus intravenously. So, what's the difference between oral and intravenous vitamin C? Is that the route affects its bioavailability. So, taking vitamin C supplements or powder, you're not going to increase your blood levels to the same level that if you had it directly infused into your bloodstream. So, according to Dr. Linus Pauling, who's kind of one of the leaders on high dose vitamin C, he was saying the first 250 milligrams of oral vitamin C are the most important because that's what's going to be most readily absorbed and most bioavailable to your body. And anything after that, you can still get benefits from. He said like up to 2 grams, you're still going to get much more benefits, but the first 250 milligrams are the most important. And when you do high dose vitamin C through the IV, you can get much higher blood levels. You can get much more vitamin C into you, anywhere from 10 grams to 100 grams of vitamin C directly into your bloodstream. And it significantly like raises the vitamin C levels in your blood to anti-tumor effects. So how high dose vitamin C works is it does two different things. Vitamin C is a potent antioxidant, as we discussed. So it's neutralizing free radicals, it's protecting against DNA damage, it's reducing inflammation, it's reducing oxidative stress, and it also helps regenerate antioxidants like glutathione. So the other side of vitamin C is that it's a pro-oxidant, and this is lesser known, but cancer cells will selectively uptake vitamin C, and the vitamin C will react in the cancer to form hydrogen peroxide, cause oxidative stress, thus selectively kill cancer cells through oxidation. And according to the study, this is because cancer cells selectively take up more ascorbate compared to normal cells through the facilitated transport with participation of glucose transporters due to an increased metabolic need for glucose. So cancer cells, they need more glucose. They uptake more glucose, and they're confusing vitamin C for the glucose, and they're taking up this vitamin C, which is toxic to the cancer cells, causing oxidative stress and killing them. So that's what the big difference is. Like if you're doing oral vitamin C, you're not going to be able to get the blood levels high enough to do that. But with intravenous vitamin C, it's possible. Quote, the next studies conducted in vitro on cancer cells revealed that both ascorbate and its oxidation product, dehydroascorbate, a high doses were cytotoxic or lethal to fast-growing malignant cells, but less toxic to malignant cells. So this study here basically confirms what I just told you, that it's selectively toxic to the cancer cells. And to the non-malignant cells, it's not as toxic. It doesn't really cause them any problems. So there's even some analysis done after the Mayo Clinic study, and what they found is the oral vitamin C doses used in the Mayo Clinic studies would have produced peak plasma concentrations of less than 200 micromolars. In contrast, the same dose given intravenously as used in the Pauling studies would produce peak plasma concentrations of nearly 6 millimolars, more than 25 times higher. So there's a significant difference between what the Mayo Clinic did and what Linus Pauling did. Continuing on here, for example, a phase 1 clinical study revealed that ascorbate concentrations could safely reach 25 to 30 millimolars with intravenous infusions of 100 grams of vitamin C. In this study, plasma concentrations around 10 millimolars were sustained for at least 4 hours, which, based on preclinical studies, is sufficient to kill cancer cells. And this is me quoting directly from the studies. This isn't my own words, okay? I'm not just making stuff up here. And the data continues, quote, xenograph experiments showed that parental ascorbate in the dose of 4 grams per kilogram body weight administered as the only treatment once or twice daily and leading to an increased blood and tissue ascorbate concentration greater than 30 millimolars per liter significantly decreased both tumor growth and weight rates of glioblastoma, ovarian, and pancreatic carcinoma cells in mice. Other animal studies indicated that parentally administered high doses of vitamin C not only inhibited tumor growth, but also reduced invasiveness of cancer cells and increased survival. So there's a lot of research out there that's showing that high doses of intravenous vitamin C can have anti-tumor effects and aid in the treatment of cancer. Alrighty, so I want to go over some of the modern studies that have been done. So what about high-dose vitamin C in advanced stage malignancies as a single therapy? So for people who just did high-dose vitamin C. So the research on it is kind of back and forth. There's a lot of studies that said it made no difference, and there's also a lot of studies that said that people just got completely better. So we'll just go over some of the few that I found here. So there was a study with 17 participants who did IVC for 4 weeks, doses ranging from 30 to 110 grams per meter squared for 4 consecutive days in a week. So it looks like they're getting, pretty high doses of vitamin C. And none of the subjects experienced any objective tumor-related response. So none of them really got any better. And this was an advanced stage cancer. So stage 4, it's already metastasized. Not a great situation to be in. So similarly, in a Hoffer study, phase 1 clinical trial conducted in patients with advanced malignancies, administered IVC in doses ranging from 0.4 to 1.5 grams per kilogram body weight 3 times weekly for an average of 10 weeks, and did not observe any objective tumor-related response in any of the 24 subject participants. So in the study as well, where they're having advanced stage cancer and they're doing the IVC, it doesn't look like it's making much of a difference at that point. And there was one more study that I found where 24 late-stage terminal cancer patients receiving continuous IVC infusions of 150 to 710 milligrams per kilogram per day for up to 8 weeks reported only 1 patient who stabilized. So those studies, it didn't show that high-dose vitamin C did much for them. But then there was also some studies where people completely benefited. So on the other hand, in a Riordan et al. Study, a patient presented with complete remission after sole IVC administration of 15 to 65 grams twice a week in 2 patients with metastatic renal cell carcinoma, and in 1 patient with non-Hodgkin's lymphoma receiving IVC in monotherapy after the chemotherapy was stopped due to side effects. So this was, a pretty cool study. Someone had cancer, they stopped chemotherapy because the chemo was, causing side effects, and they did high-dose vitamin C and they got better. Let's see, there's another one. Authors also presented 1 case of resolution of skull metastasis in a disseminated end-stage breast cancer patient receiving vitamin C in doses of 100 grams 3 times a week, and no reoccurrence in a woman with non-Hodgkin's lymphoma receiving IVC as the only treatment after completed radiotherapy. So it looks like those people got better. So basically what this meta-analysis was concluding was that there was no conclusive evidence. Like, there's a lot of research that said people didn't get better, and there's a lot of research that said that people did get better. So what's the take on it? Well, it doesn't look like anybody got worse because of the high dose vitamin C, so that's good. But it definitely seems that, in advanced stages of cancer, it may not always work. But earlier on, it seems like there could be some benefits to it. This was actually really interesting, but the meta-analysis did conclude that it actually helped reduce pain during cancer, and it actually did improve quality of life in everybody. So what they said is, it is supported by the results of the observational study by Cameron and Campbell that vitamin C administration reduced requirement for opioid analgesics with no further need for opioids in some cases. So cancer patients their pain was being reduced by the vitamin C, so it helped improve their quality of life. And a lot of people want to know, well, how safe is high dose vitamin C? So it's actually generally pretty safe. And I'll read you what they said, because just read what the study says. High dose IVC is considered to have a relatively good safety profile, providing that appropriate precautions are taken, although it also can have serious side effects in some patients. Vitamin C in gram doses is contraindicated in patients with glucose 6-phosphate dehydrogenase deficiency due to risk of development intravascular hemolysis. For this reason, red blood cell G6PD screenings is required before applying vitamin C therapy. So, for those of you who may need a better understanding of what this is, it's generally really safe. Like vitamin C in high doses, it's not really toxic to your body. And in all the cancer patients and all the studies that we looked at today, nobody got worse because of the high dose vitamin C. They either got better or they didn't get better because of cancer. So that's, pretty good news. However, with high dose vitamin C, you do have to check for a G6PD deficiency, because if you have that deficiency, and it's not that hard to check for, it's a simple blood test and they'll tell you, then you won't be able to tolerate high doses of vitamin C. It's going to be too much oxidative stress for your body, and it can trigger hemolysis, so your red blood cells are going to break down. So as long as you don't have a G6P deficiency, then none of the research here is showing that it would be a bad idea to at least try high dose vitamin C if you have cancer. So what's the conclusion on high dose vitamin C? So it's not a cure for cancer. It's not always 100% going to be effective, but there's a lot of research that indicates that high doses of intravenous vitamin C has anti-tumor properties and can help in the treatment of cancer. However, if you have a G6P deficiency, then you wouldn't be qualified for this treatment. So it doesn't always work, but it can work. And if you have cancer and you want to try a more holistic approach, or you want to couple high dose vitamin C with chemotherapy and radiation, then you have options. And I'm not here to recommend you any types of treatment, but I'm here to make you aware that there was some research on this and that there are some pretty interesting results. So if you're interested in high dose vitamin C, I would just highly recommend you read a lot of the studies for yourself, do some research. I'm going to link all these studies in the description below. And if you're trying to figure out how do I do high dose vitamin C, if it's something that you want to pursue, look for any kind of either mobile IV clinic or med spa or some kind of holistic clinic. A lot of them will offer IV therapies, and high dose vitamin C may be something that's included. Just make sure that you get some blood work done and test for a G6P deficiency. They should walk you through that, but if for whatever reason they don't, just make sure you get some blood work done. Alrighty guys, I hope you enjoyed the video. I know it was a lot of information, but now you have some of the tools that you need to make a better decision for yourself and understand if high dose vitamin C is something that you may need for yourself or for someone that you love. If you enjoyed today's video, make sure to subscribe to the channel, leave a like, and let me know in the comments below, what do you think about high dose vitamin C?